Hello, everyone. Welcome to the Infection Control Exchange podcast. I'm your host, Wayne Tucker. At this episode, going to do things a little bit different. Want to focus on kind of explaining like who the host is and my background and experience, so you have a better idea, who's speaking about these variety of topics to date. So, just a quick recap: I've created the podcast about mid-October. And this episode that I'm recording today, I meet the host for the Infection Control Exchange podcast. Will be, I think, total episode 25, which is actually I'm very proud of that getting to this point because 25 episodes in, what's that, 4 months, I think it's pretty good. But I did want to, like every so often, I think it's a good time to kind of provide, an explanation about my background, my experience, my education, where is the podcast, what we've been doing to date with the podcast, and look at where we're going in the future. And one of those things I'm very excited about is the IPAC conference that's coming up in towards the end of May this year in Toronto. So we'll be the official podcast at the conference, and I'll be doing probably somewhere between. I'll be happy with around maybe 12 podcasts that I'm going to be scheduling for the conference. So, and I've got a dedicated room that the conference organizers have set up for me, which is very much appreciated from IPAC Canada. Uh, but for this episode, kind of title I put to was, who was behind the Infection Control Exchange. There's many different things, including the podcast, and why can you trust this platform? So, I think it's good to get an understanding, and who's speaking there, and whether depending what platform you're using, you're either listening to the podcast or you're watching the podcast on a variety of platforms. So I upload the episode on Spotify and YouTube, and also on Apple Podcasts and Amazon Music. And I do all my announcements with the various episodes and release on LinkedIn. And that's kind of how I've been doing the release for the podcast, Infection Control podcast. So, um, there's so many things to talk about, but want to kind of give, an explanation, and like I said, who I am and, why I built Infection Control Exchange and what you can expect from this platform. So let's get right into it. I'm going to divide it up in a variety of segments, which I do with most of the episodes. But to start, like I said, today's going to an opportunity to meet the host, myself, Wayne Tucker. So you understand, my perspective, my experiences, and the standards that I stand behind. So kind of give you an idea that it is not going to be like a detailed review of my resume, but I'll do kind of a summary um, of it, of my experience and my education. And if I can, I probably might upload a copy of my CV with this post or in another post. Will be a long version for those that want to kind of get a really like take a look at a more detailed level my education and my experience. So I'm going to try to find a way to do that. Either when I publish this episode, or I'll put it in the comments. I think I can put in a document, and you can just take a look at that long version of the CV that I've created. Um, so it's kind of start my education. Uh, it starts with, I guess, a background in psychology many years ago, and then part of that I did a master's of science in applied social psychology. And I always tell people this is not clinical psychology, even though I did some of those graduate courses at one point in my career. But this graduate degree was actually, there was only 3 graduate students accepted in this program. It was the first time at Memorial University, Newfoundland, that the program was created. So myself and 2 other grad students did this program. The program was designed, you had to do, so many graduate courses, and then you had to do 3 full-time work placements, and you actually had to do a master's thesis. So actually, it was quite a lot, and it was completed over a 3-year period. So with the experience of, you were kind of trained to kind of be like I don't know, best explanation actually really is like a fixer, of any organization, healthcare organizations to go in and handle any type of problem they got and work on a variety of solutions for them. And I did that in one government organization and a couple of healthcare organizations. So, but that was, applied social psychology, and that's kind of the program. Um, and then at my education, I was at one point uh, a graduate student, a PhD student at the University of Western Ontario. Many years ago, I um, did very well in the program. I think I got close to 90 average in the program. So was at the top for PhD students. But made a difficult decision at the time for financial reasons to leave the PhD program. It's probably one of the most difficult things that I've ever done. To leave something that I was enjoying to do enjoying very much, doing my courses, and I was just about to start my PhD thesis. And I did my uh, comprehensive exam, and just financial reasons, I just could not continue in the program. It just wasn't enough funding, and I was working a variety of positions, and I just wasn't able to do it. So I made the difficult decision many years ago to withdraw from my PhD program in epidemiology and biostatistics. But I did get, like I said, I still did the coursework, got a lot out of that part of it. I very much enjoyed my time at the University of Western Ontario as a graduate student in the PhD program. Did I, many years later, I guess I did a graduate certificate from the University North Carolina, in field epidemiology. Very much enjoyed that graduate certificate. And then I kind of took a break, I guess, for many years. In some ways, I kind of wish I didn't take that kind of long break. But in I did in 2020. I started a executive master's in business administration, and did that. Was a full part of, I believe, 14-month program. And very much did that. You had opportunity. You had to do so many core courses, and you had to do so many specialization courses. But I was so passionate about it that you only had to do, I think it was 3 of the 9 options for specializations, but I was enjoying doing them so much, and you could do as many as you wanted, that I did all of them. So I did all 9 specializations for that program, including things like the blockchain. There was a variety of courses that you could do. A law, course on law. So it was many I did, but I decided to do all of them. I'm glad I did start as well. Then I did the Queen's course. I decided I wanted to specialize in infection control, so I did the Queen's University infection control course. Um, and after that, well, getting to the work experience a bit later, but did that. I did a couple of prep courses for certification in the U.S. So a couple other courses that I did, like the Queen's University course. Um, and what else? Got certified in infection control. I'm not going to go through the entire story, but I ended up getting both certifications in a very short amount of time. So, but I'm certified in infection control with the CIC, and I also have the long-term care certification in infection prevention. So, of those, and in 2023, I guess, um, we made a decision to, I just want to continue on with my education in infection control. So I did a master's of science in infection control through the University of Essex. Very much recommend the program, some of the people, at least one person that I've recommended to the program to is now been accepted into the program. But I do put the caveat that it's great professors, but it's a very challenging program when you're working full time like I was. So I always kind of tell people who decide to do it, it is not an easy master's of science program to complete. Um, so that's kind of my education. I think I've kind of got it all covered. And then in terms of my uh, work experience, first part of my career was research. So I worked for like Memorial University, Newfoundland, University of Western Ontario. I worked for researchers in London, Ontario, associated with the UWO. Work for Dixon's Research Foundation. I work for an international organization, the Cochrane Collaboration. I work for the Center for Addiction and Mental Health, and I work for the Institute for Clinical Evaluative Sciences, if I had that right. Um, and then did that for the first part of my career, and then made the move to into public health. So my first position in public health was actually as an epidemiologist for a public health unit in Ontario. I did that for about 3.5 years, um, supporting all areas uh, for infection control, all areas, infectious diseases, everything. So I did that, and then I had an opportunity to go into to be a program manager for a number of public health programs, including sexual health, all the immunizations at the time, uh, West Nile virus, as well as like infectious diseases, infection control. So a variety of public health programs. I did on-call for uh, many years there at this one public health unit, but I was backfilling someone else. And once they were scheduled to return, I was applying for positions. I was very fortunate to get a position um, in another public health unit in Ontario to be the director for communicable disease control. So very long story. I'm not going to go through all of it, but that portfolio changed like every 12 months. More and more was being added to my portfolio, which I very much enjoyed, but it was a great challenge. So in the end, I was responsible for infectious diseases, infection control, all the vaccine programs that we offered. I led and operated a fee-for-service travel clinic, um, tobacco enforcement, tobacco cessation, harm reduction, all those other programs. I've gone through infectious diseases, outbreak management, pandemic planning. It was an awesome portfolio to be responsible for. Um, and I participated in the designing and the user groups for a new public health uh, building, which was very exciting. I very much enjoyed that. Um, but at some point, like, well, that position ended. to restructuring. So I went to work uh, uh, in Alberta, where I was a director for infection prevention and control for a couple of years there. Very much enjoyed it. It was a great portfolio, responsible for a couple of regional hospitals as well as like 7 rural or hospitals or urgent care centers. But they made the decision to come back to the East Coast to be closer to family at the time. So I worked in a community health center uh, for a couple of years, where I was responsible for a very interesting portfolio with primary care, um, as well as the dental program, and which was very new to me. The dental program is as the same as the primary care, because I never did either of those programs before. So I was managing a community health center with an interdisciplinary team of professionals, dietitians, social workers, physicians, part-time physicians or locum um, physicians, with nurse practitioner, support staff, mental health nursing, community nursing. So a great team, as well as the dental program, which was very complicated. I'm not going to go through all the details, but it was a pretty much free dental clinic, which is, can you imagine? That's a significant challenge to run and operate a free dental clinic, but partnering with Dalhousie University and dentists in the community and stuff that were willing to give their time. We were able to operate pretty much a free dental clinic within the Halifax area. So um, that, and then some of the other positions that I've been in, I've worked now uh, in long-term care. So I've worked in total for uh, 3 long-term care uh, organizations in different positions. One is a director position, and another one as like infection, an IPAC or infection prevention and control um, manager for a couple of long-term care homes in Ontario. So um, and now kind of currently just working for myself, doing consulting. I kind of started uh, this platform, this podcast platform, and also involved with designing products, some product development is another part of it as well. So it's kind of sort of consulting, product development, excuse me, and the podcast. So kind of start. So I started the infection control exchange. I guess called an ecosystem. It was probably later in the fall, maybe November. I started with the podcast first. So and it's a great opportunity. I wanted to create the platform, um, this podcast to talk about, some of the gaps that I've seen, draw upon my experiences, working across different organizations and within different provinces as well. I try to like have a variety of topics that you probably noticed that are being published. So I've done this, for example, I talked about leadership and importance of the leadership in infection control, and when there's problems in leadership, how it has a rippling effect. I've done a 4-part series on construction. I've done a 3-part series on lessons learned from COVID-19. So a variety of episodes that I've created. And like I mentioned, I think this episode will be episode 25. So it's, I kind of want to get into like I'm not gonna one particular area specializing in. There's so much that interests me with infection prevention and control that I'm willing to dive into pretty much any topic. Sometimes I'll have to read up on some of the topics a little bit more. Some of them will be very familiar to me. And I'm also involved, kind of in 2026. I want to get into doing more, having more guests on the podcast because I really like that idea. And I did one so far with Bunzel collaboration that I put out a few weeks ago. Um, so kind of like take a look at many different topics, outbreak management, everything. So, and hygiene, PPE, like this, so many different topics to get into and talk about. So, but I wanted to talk about, um, and I think that's one of the things will make take podcasts to a different point is having the guests on, where you can have that conversation a little bit easier, I find. I'm hoping. I'm really looking forward to doing probably about 12 podcasts, up to maybe 14. It will be a very uh, busy conference for me, a different conference for me in Toronto in 2026. Uh, and like I said, I'm going to be doing a variety of podcasts there, recordings, and allow all the equipment there. We set up, we'll each all have a mic. And I'd probably have two guests on the other side of the table, sharing a mic if a couple people want to do it together. But I think really looking forward to the face-to-face one. I just can't do that face-to-face podcast very much of that based out of Halifax. So, um, but this podcast, I'm very much enjoying talking about a variety of issues and releasing the podcast. But I'm not going to go too much into. I'm not going to get into today about the behind the scenes. So I can always do that another time. But the podcast is a way for me of making IPAC or infection prevention and control more accessible, more practical, and more honest. So you will notice that, like, I'm not shying away for some of the difficult topics, because I don't think, that's what we should do. I think we should address some of the problems that we're having in infection prevention control. And you will see me talk about those more complicated or more sensitive issues. The one that I put out just a few weeks ago about leadership not following IPAC measures. I felt that was a very important episode to publish because, but it's also a very sensitive topic, because um, some people may interpret it that you're coming down on the leadership, and that's not the case at all. I really created it because our role in infection prevention control is to protect our clients and our residents. That's what we're responsible for doing as being, an IPAC lead or director or manager in infection control. And if you see something occurring where, for example, in this case, leadership is not following the protocols, then you need to take appropriate action, make sure that they are held accountable. Doesn't mean that you're going to be the one you know, dealing with that lack of compliance. That will be, responsibility of their direct report. But you will, like I mentioned in the podcast, will be responsible for doing general education to the leadership team, explaining to them, what the importance uh, of following the IPAC measures. And I'm not going to go into too details with that. You can check out that episode. Um, but I'm hoping with so far, like I said, I want to kind of create this episode, chance to talk, meet me, get to know me a little bit better. It's something that maybe I'll do, every few months or so. Let's come on and just talk about it because I'm building the audience, and not everybody's going to go back, right from the start of when the podcast got started, and listen to all the other episodes. I hope they do, but that's why every so often I just want to kind of do an episode where I'm kind of introducing myself to the audience, and is a great opportunity to share my share my experiences, my education, what I've accomplished to date. Like I said, I've spent over 20 years working across multiple healthcare environments, which I talked about. I've worked in academia. I've worked in public health for 12 years in three different positions as an epidemiologist, as a manager and a director for public health programs like infection control, infectious diseases, vaccine program, all immunizations, travel clinic, harm reduction, tobacco enforcement, tobacco cessation. Um, you know, and I've worked in acute care with infection control. I've worked in long primary care, and dental care, long-term care. As I mentioned, three long-term care homes I've worked. And now I'm currently working for myself as building the infection control exchange ecosystem, including doing this podcast and consulting work. I've already talked about that I have dual certifications at the CIC and the long-term care certified in infection prevention, completed a master's of science in infection control. I'll talk about that. And I think it's there's like a fair bit kind of explains. I think the best way I can is the perspective that I bring to the podcast is very broad because I've worked in so many different places where I've been responsible for infection control. There's other things like I mentioned, immunizations, infectious diseases, outbreak management, pandemic planning, and I've been part of that in many healthcare sectors. Um, and I've seen over the years many gaps that I've been trying to fill. Still see gaps, and I think that's probably we'll continue to see that. I'm very excited about what AI can offer IPAC in terms of the future. I've done an episode on that as well. What does the future look like with infection control and AI? With that kind of partnership, and what that's going to bring for into the future. Um, but I think let's moving on to the next segment here. Um, experiences, I guess, that have shaped my approach. Some of the field lessons, I guess, that I've learned. I guess one of the first ones is the risk is usually hidden upstream. So and by that like an outbreak isn't the beginning of the problem. As I've talked about earlier, between difference between control prevention. We want to focus on the prevention. When an outbreak occurs, we're in control mode at that point in time. We're going to just kind of reduce the transmission on the floor of the unit. But it's more important to focus on the prevention so we don't have those infectious diseases or those pathogens even coming into the long-term care home or the acute care hospital setting, right? So that's like a very important lesson. I think that we all need to pay more attention to. And as I've talked about in previous episodes, that we're working for a very vulnerable population. And I think that sometimes that can get kind of lost in the messaging is that, we are working to protect those that are most vulnerable. Um, and they're really relying on us to protect them from everything. That's all infectious diseases, all of these pathogens that could do significant harm to these vulnerable residents and patients, so of a healthcare setting. So we need to do everything we can to protect these vulnerable patients and residents. So um, another thing, I guess, a lesson learned in terms of my experience, I guess a field lesson number two is, the culture beats the policy. You can have all the policies. You can have 400 pages of policies just dedicated to infection prevention and control. And you can focus on compliance and you can focus on auditing. You can do your audits and try to get your compliance up. But, the culture will beat those policies all the time in terms of actually making a difference. So you can have all the policies you want, but if you don't have that culture built and building it for infection prevention and control, you will always struggle with the implementation of all those policies, which are very key. The critical part always comes down to the culture, and you can't build a culture from a top-down approach. You have to build it from the frontline staff up and getting their buy-in. So if you're going to take just a policy approach where you're just going to push down that policy manual and expect that everybody is going to implement it, including your leadership team, I think you're going to be unfortunately very disappointed. You really need for sustained infection prevention and control change. You got to build your culture from the frontline staff up, get their buy-in, answer their questions, talk to the frontline staff, find out what the problems are, what issues they're running into. This is not a job that you can do from behind your desk. Part will always be like that, but you've got to build that culture. So that goes, and once you get that culture built, and I've done an episode on it, so I'm not going to go into too much detail, but you will have something that will be very sustainable and will make a significant difference day to day. Because what it is it's all about. It's not about compliance. It's about staff helping one another out. Um, every shift, every moment, identifying when someone missed something, it's a performance issue, is to make, IPAC better for everyone that's working, protect the frontline staff, all staff, as well as the, residents and patients as well. So, but you don't build an IPAC culture like any culture overnight. It takes a considerable amount of work to build it. And you always be at risk of losing it very fast if you don't constantly work on it and sustain it and maintain it. Right. So it could take you 2 to 3 years to build that IPAC culture, if not longer, and you could lose it within months if you drop things and don't work on sustaining it. So that's another important lesson learned that I have through my professional experience working across all the healthcare sectors. So um, another one, and I've dedicated because some of it because of strong interest in the lesson of construction, and I've done a 4-part series on that, like I mentioned earlier. Um, and that's rather because I have a very strong interest in construction, but it also is an important lesson learned there in terms of involving infection control very early in the process. Very early by meaning right at the design stage and not at the later stages where you're opening in 3 or 4 months, and then you involve infection prevention control. So I had done a 4-part episode on that. So please take a listen to that. Go back and go through those. And there's so much with construction. And I've thought about maybe I will expand it and do another 2 or 3 parts to that because construction is so complicated, and there's so much to it that I still want to talk about, including positive and negative pressure. Some of the things I want to get into a little bit more detail. Traffic patterns, it's a water system. So I might do another 2 or 3 part episode on construction in 2026. Um, but these are just a few of the lesson learns I wanted to talk about, um, as well as you know developing the framework for the podcast. Um, there's so much to be discussed. Um, if some of the principles, I guess that I think we should all think about for IPAC. when it comes to, transmission of infectious diseases, is that a principle of that real world practicality. Um, so like if you can have all the control measures you want, you can have your anti-hygiene program, you can have your PPE, you can have your masking, um, all the control, but if the control measures can't be sustained on a day-to-day basis, especially when you're in an outbreak, then it's really not going to protect anyone very much, right? So you got to um, be able to sustain those control measures all the time, regardless of the shift, and that really circles back to the importance of that IPAC culture that I talked about, the importance there. So that's kind of one principle. I want to kind of briefly talk about is that real world practicality and the importance of uh, having control measures for infection control that you can sustain all the time. Another principle is that I guess the risk layering. So no lis- no single control is ever going to be enough. So that's important. We talk about various controls. Whether they're admin controls, engineering controls, workflow design, PPE, training, auditing, your hand hygiene, all those control measures have a layering effect, right? So by that is you got of all these things working together, and by doing that, you're creating certainly a more comprehensive infection prevention control program, but you're layering things up in such a way that's reducing the risk more and more, right? So more of you have these things, control measures in place, and the fewer the gaps that you have, then the more likely you're going to be able to control the transmission of infectious diseases and pathogens. Less likely you're going to be in an outbreak. I think that's a very important measure for any acute care hospital, long-term care home, is how many outbreaks are you having? Uh, you know, that's not if you're in always an outbreak all the time, that's not a very good indicator, very good for the home or for the acute care hospital, because it shows that your IPAC measures are not very effective. And that's the reason why you're going in and out of outbreak all the time, is because you have a IPAC program that's not comprehensive, and not well managed, and you got too many gaps. So this is why that layering that I'm talking about, the risk layering, you got to make sure you're doing a good job across all your control measures, and then you will have something that's going to make a very big difference in terms of your outbreak management, in terms of the transmission and spread of infectious diseases. So, like I said, our goal is to protect those vulnerable residents and staff. I can't emphasize that enough. Uh, we've all decided to work for healthcare, and when we made that decision to do so, we decided that we're going to work for the most vulnerable members of the community, that are in a long-term care home or an acute care hospital, and therefore we need to do everything we can to protect those vulnerable residents and the staff. And therefore, as I mentioned, I think in the last episode that I published, you can make a real difference, because the difference when IPAC is uh, implemented the right way, and you're protecting the residents and the patients, is that you're saving lives without a doubt, right? These are very vulnerable individuals with a variety of comorbidities, and very frail. And if they get influenza or COVID-19, that could result in their death. So that's how serious it is. And I think sometimes we forget about that responsibility that we have and the impact that we can make. So I don't want to lose that message, and just want to bring that up. Uh, you know, I guess another overarching principle that I want to talk about is that early involvement you know, prevents many things. So it's if you get involved, like the same as in an outbreak, you pick your topic about an outbreak management is one of them, right? If you don't get on top of things very quickly, an outbreak quickly gets out of control, and then it makes it much harder to reduce that transmission and get that outbreak declared over, right? So if you get into an early prevention or with an outbreak control of it, you will get it out of outbreak that much faster by implementing your IPAC measures, and uh, you'll get control of it, and it'll be declared over by public health, right? So it's when you implement, just that if you're expecting, day to day, um, not to worry about infection control, it will handle itself. That's not going to be the case. Every day you got to be working on infection prevention and control, on educating the staff, including the leadership team. So you got to be working on it, and that all that work that you put into it will have a big difference in terms of managing the transmissions of various infectious diseases and pathogens, and you will protect the vulnerable residents and patients. So it is something that you get the benefits from, um, and the other benefit is that is very serious. Is you have a lot of regulations in place, um, and there are things that we need to follow on, and I very much welcome those. I've always welcomed those inspections from outside ministries, because for me, it's an opportunity to get that individual perspective to see if you've got gaps in your infection prevention control program. I know a lot of people take them a different way, but I take it in a very positive way, that you're trying to develop your program in the best way, and is a chance to see if you have any gaps. And if they see gaps, then you should be more than willing to want to change those, because you want to have the best program possible, right? So don't be nervous or anxious about those inspections. Approach it in the right way, and benefit from it more significantly in that way, um, by kind of participating, answering all the questions. And if they see gaps or find gaps, then you have some things to work on, right? There's no such thing as a perfect infection prevention control program. There's lots of people within organizations that can help you, a variety of consultants, quality, members of your leadership team. Um, so yeah, there's a lot of things to think about there with that part. Um, I think it's important to respect everybody on the team, you know, respect people, frontline staff, leadership team, but you always got to be honest about your approach, even though sometimes you will deal with some difficult issues. It's important to always be professional, but you're gonna come across those difficult situations, which I talked about in the episode on leadership, where leadership members, team members were not following the protocol of staying at home when they were sick, and the risks that they were putting residents and patients at for transmission of infectious diseases. So it's important for them to stay home. So I talked about, you obviously want to be telling the truth, but you don't want to be avoiding those hard situations. You're going to come across them, because a lot of people that are managers or leads or eye infection control professionals are going to have to get comfortable dealing with a variety of issues and bringing those issues up with a variety of professionals, physicians, nurses, charge nurses, DOCs, ADOCs, senior members within an acute care hospital, leadership team. So you name it, you're going to run into issues that you're going to have to deal with, and you're going to have to give your honest perspective about those situations. So, and that again, keep thinking about who you're protecting, right? You're protecting those vulnerable residents and patients, and then that will guide you through what you need to do, right? That'll be your kind of compass through dealing with these difficult situations, and it won't lead you wrong. If you're focusing on protecting the vulnerable residents and patients, and that's your compass in terms of infection prevention control, it will lead you in the right direction. And you can always reach out to a variety of people for support when it comes to infection prevention control, either within your organization or outside your organizations. So, um, I think, um, what I've tried to do with this podcast is to make it very comprehensive. I like talking about a variety of topics. And I've done so much so far. Like I think this is as I mentioned, this is the episode 25, which I'm very proud of because that's a huge accomplishment in a new podcast that's only 4 months, but 4 months old. Um, but I do like to talk about all the different topics. I'm not shying away from any controversial or sensitive topic. I'm kind of, guest speakers giving their input on what they would like to talk about. If it's something that, I'm not too familiar with, and like anything, infection control is very broad, then I will just do my research and educate myself and learn up about that particular topic, and be prepared for that podcast when I do the recording with my guests. Um, so yeah, so really no topic related to infection prevention control that's off limits. I want to be able to talk about any of the topics, as well as working with industry partners. Like I said, I've already done one episode with Bunzo, talking about just the disinfection, and the key role that environmental services plays in managing the transmission of infectious diseases and outbreak management. So excited to be working with industry partners as well. There's a variety of topics. I'm not going to go through it. I did put up, I think, couple months ago, a list of topics that I plan to focus in on, and that will kind of guide some of the discussion. But I think if you work in infection prevention control, there's just so much that we can talk about, right? There's so much, including I did an episode on preparing to write the CIC, or the long-term care version exams as well. So I have a very broad interest in infection prevention control, and I'm planning to talk about all areas, all topics, all settings, long-term care, acute care, primary care, any community settings as well. So, like I said, there's so much we could talk about, and I certainly look forward to talking about those episodes with the Infection Control Exchange podcast. So very much looking forward to getting into uh, all those different topics. So it really is. There's so much we can talk about, right? Um, and I think uh, moving quickly to the next segment is the audience. You know, like who is this podcast for? And we'll go through a few different groups. But for all infection preventionists and all infection control leads, IPAC managers, anybody that's working in IPAC, I think this is a great podcast for you to listen to. Like I said, it's got practical language. I try to make it try to make it interesting. There's so many other things we can talk about. So I think it's very interesting for anybody that's working directly in infection control. It's certainly of interest to anybody, long-term care leaders, anybody that's a leader in acute care, because as I said in earlier podcasts, I kind of look at infection prevention control like health and safety. We all have a role to play in health and safety, and same like that, we all have a role to play in infection prevention and control. So anybody who's an healthcare leader, regardless of your healthcare setting, I think it's is a great podcast for you to listen to. So anybody that's a program manager, anybody that's involved with, more system level thinking, for example, standardizations, surveillance, we all have a degree of accountability in all of our roles in healthcare. I think it's of interest to anybody that works in construction. And like I said, I've always talked about done a series on that. I think I might do 2 or 3 more episodes focused on construction. And yeah, and it's certainly important to anybody that's working in safety, senior leadership, anybody that's working in environmental services, housekeeping. So, like I said, it really is a podcast, I think, that's got relevance to anybody that's working in healthcare, because you can't get away from the importance of infection prevention and control. Uh, it plays a role every shift, daily, every minute of the throughout the shift. Infection prevention and control plays a important role. So that's why, when I've talked about audience, I kind of highlight a few of those key uh, audiences out there, but really it's got relevance for anybody that's working in healthcare. So please share the please share the announcements, like on LinkedIn, within your platform, because it's something, it takes time to grow. It's very much a niche podcast. So it's not, it takes time to build up the audience, and I need the help of everybody that follows the podcast to share that within their platforms. Um, I've already talked about Abaddon, available on all the major platforms: Spotify, YouTube, Apple Podcasts, and Amazon Music. So there's plenty of ways for you to listen to the podcast. So, um, and I think this platform, it really does connects to real work. And the other thing, if due to the consulting, so if your organization needs the support, there are many areas that I can help. You know, Outbreak management, you know, assessments, so outbreak readiness, own specific outbreak plans, IPAC audits, risk assessments, anything with construction, I can help your organization with that. Staff education, and leadership coaching on, developing an infection prevention and control culture. Um, Mass fit testing, help you with your hand hygiene program, PPE or auditing, um, building that IPAC culture. There's not too much of developing and helping you with your immunization programs. Like I said, I've got a lot of experience in that, doing that from working from a variety of organizations, including long-term care. And I managed the immunization programs and ran a travel clinic for public health for many years. So the depth of my experience, I guess, uh, in- in- with my education that I can do in terms of consulting work is quite broad. So please reach out to me if you've got anything that I can help you with. And that's part of my infection control exchange ecosystem is the consulting part, and it doesn't matter if it's within the province I'm living now, Nova Scotia, or anywhere in Canada. The bulk of this work can be done. A lot of it can be done remotely, and it doesn't matter what country as well. So I've got everything set up with my website uh, to for payment for contracts and everything. It's all set up through my website, which is www dot exchange.com. So that's my website that I have. Um, And, in terms of, this platform, this podcast, I'm kind of want to make, um, you'll see when you watch the episodes, I really want to make like this a podcast. So I really want it to be like a conversation. And that's why I'm looking forward to doing more episodes with guests is it gives me a chance to talk to people and you get that back and forth where you're kind of getting the shared experiences of two people, not just myself, and you're getting the experience and the feedback from other infection control professionals uh, or other experts in other fields as well. So please, take some time to subscribe to the podcasts. Very much appreciate that. I've already mentioned, share, do some reposts. I would very much appreciate those reposts on LinkedIn, so that more and more people get a chance to see that I have the podcast and the episodes that I'm releasing. So please, if you could repost that and subscribe and to the podcast and just share every one of those opportunities helps me develop the infection control exchange ecosystem and including this podcast, right? And all those opportunities is opportunity for growth for myself and the platform, including the IPAC conference coming up in May, which I already mentioned. Very much looking forward to that. It's an opportunity to meet with a variety of experts and have those conversations on a variety of topics. So, um, please, if you're interested in participating in, being a guest, doing episodes over Teams and doing the recording and doing the podcast that way. Also, if you're interested in being part of the podcast during the IPAC conference in May and towards the end of May in Toronto, we can schedule that. I've already got a few booked, but I want to try to get many of those booked before the conference because it will be a different conference for me because I'll be focusing on doing the podcasts with a variety of experts in the field. So thank you very much for listening today. My name is Wayne Tucker. I'm the host for the Infection Control Exchange podcast and then the broader ecosystem. And I very much appreciate you listening to this episode today. So, like I said, this episode was a little bit more focused on, meeting the host and as well as, learn a little bit more about the podcast and other components of the Infection Control Exchange ecosystem. Thank you very much.